Hello ladies and gentlemen, my name is Brian Wright, founder and CEO of BizBlitz. Appreciate you taking the time to listen to this brief video today about our outstanding treatment program, what it can do for your practice. Now, first and foremost, let's look at the stats. The average dental practice, or just a practice in dentistry, because it includes orthodontic practices, oral surgery, etc. If you are in the dental realm, the average practice that has been in business a minimum of 5 years has an average of $2 million or more in outstanding treatment just sitting in their charts. Now, just so we're on the same page and we're defining outstanding treatment the same way, we define outstanding treatment as any patient that enters your practice, you have prescribed treatment and they walk. They do not put down a financial commitment today and they leave. What is your systems? What is your process to get those people back to the doors? The facts are the healthcare practices, dental and specialty, as a whole fail at a very high level to get patients back at the levels they should. So a lot of this commercial training that goes into ensuring that your follow-up procedures are done in a very specific way and your staff is trained to do that is impeccable, imperative to do in order to maximize the success of your practice. So many doctors, so many business owners are out spending money on postcards and trying to drive new patients in, which obviously we can all agree is important. However, if you focused all of your efforts on just your patient charts and getting people back through the doors, you would grow more than any other type of new patient marketing that you're going to do from an external standpoint. We train, and our telephone training is very comprehensive. It covers every inbound and outbound call to the practice, because if your person that's making outstanding treatment telephone calls in your practice is not commercially trained on what questions to ask, how not to ask open-ended questions, how to stay in control of the conversation, you will lose opportunities. So we're going to train the person making or the people making those calls to get patients back through the door exactly how those calls should go to maximize your success. We also have an email program that will implement a series of templates, videos, things like that that goes out to patients to try to entice them to come back in, and a lot more as well. Now, and very important that you are tracking statistics on how many calls you are making versus how many you're scheduling, and also tracking what the potential production of those patients scheduled is for your practice, so you see the value of those calls. Another great way to bonus and incentivize employees as well by tracking that. Again, overcoming objections. What happens if the patient says something on the telephone? How is your staff handling that objection? Whether it be a price question, insurance, or hundreds of other things they could ask. How is your staff handling that? Are they trained? Where did they go to school to get that training? What kind of commercial training do they have so you have the peace of mind knowing that if objections are asked, your staff can properly overcome them to ensure your success and to maximize the success. Now, we have a 5-step process to get more patients back, and that's what we're going to implement into your practice. It's a series of different trainings, email templates, phone calls, how to control your schedule, place certain people in charge, and a lot more that goes into that 5-step commercial process to get more patients back through your door. Really helps practices a lot. Looking forward to working with your practice, and I appreciate you listening today.